Hey folks, Papa Joe. Part two, according to Papa Joe. Just to touch base again on some of part one. Fill in a few spots there with things that I think folks really need to know if you ever have to deal with what I've dealt with. It's only 10 o'clock at night. As you've seen from last night's video, I got up about 2:30 in the morning. Dog woke me up. Did what I did, made the video, other stuff. Went back to bed, I don't know, 6:30, just before 7, right before the sun came up real good. Wound up sleeping till 11, a couple minutes after. Threw my whole day off because I ain't used to sleeping that late. Usually, regardless of what sleep I get, I'm up 8 o'clock, sometimes earlier. But usually I'm up by at least 8, 9 o'clock. So 11, a little after 11 was, threw my meds off. I take my vitals every morning. Still losing weight. Lost a pound, basically, between yesterday morning and this morning's weighing. So, still dropping weight. I told you before that I stayed up there the 250 to 260 range for several years. I used to be bigger than that. Me and Grandma went on the Atkins diet out on the truck, which was very hard. But we both lost a lot of weight. I got down to around the 230, if I remember right. I was right at the 300. So I was quite pleased with dropping 70 pounds. After we came off Atkins, I did put a little bit back on, and I bounced anywhere from the 245 to 260. You know, give or take somewhere in there. I was fine with that. So going when all this started, I was right at that 260. A lot of it was water weight, which we'll cover that later. Now I'm down to 208.8. So in the, let's say, last year, I've lost right at 50 pounds. So, whether that's good or bad, I don't know. It goes in spurts with me. Here lately, I've been losing more than I did in the beginning. They have me on a lot of pee pills. I call them pee pills. They call them diuretics and different things. We monitor that a lot according to my weights and according to my swelling and my coughing. I might get to coughing, and there's so many people that think if you're coughing, it must be the evil cigarettes and all this other nonsense. No, it's not. I've been smoking long enough that part ain't it. What gets me is I retain liquid around my heart, and it gets a squeezing on my heart and my lungs, and that gets me to coughing. So, could some of it be from the cigarettes? I'm sure, but it's irrelevant at this point. So I'm trying to block that light there from you. Let's see if I can move it just a little bit. That's about as far as it's going that way. So yeah, we monitor all my vitals every morning when I get up, which, like I said, is anywhere from 6 o'clock to 9 o'clock when I get up. And I'll get up and I'll use the bathroom, get rid of that water weight, and get awake. So before I go drinking any liquids or anything else, I will get my weight after a few minutes and take my blood sugar, do my blood pressure, do my temperature, do my pulse, my heart rate. And we get all that stuff, and Grandma's got a log over there that she keeps. She's very methodical about this stuff. Very anal about it too, let me tell you. She don't tolerate me missing very often. See if I can adjust that just a little bit better for y'all. So, don't want to show too much of the man boobs. So that's that part. I'm on different medications. One of them's called Wolfrin, I think. And it's for my Coumadin. I call the Coumadin clinic every week. We have a machine here that we do a INR number, I think it's called. And it tells them the thickness of my blood type stuff is what it is. It tells them what the clogging rate is and other stuff. And they want it at a certain number. They want it like between 2 and 3. And normally I've been down there at 1.5 or just below. As we work through stuff, we're getting it up. We just did a comparison with our home machine against the one in the lab. They did a blood draw to do theirs. We was 2 or 3 points different. The Coumadin clinic called today and we discussed it. Well, them and Grandma mostly. So I passed everything over to Grandma on this stuff. And they said it was within acceptable range for them. Okay, if they're happy, why shouldn't I be? Now, as I said, I turned that over to Grandma. There's a lot I turn over to Grandma. She is a retired nurse. She was LVN here in Texas for 30 plus years. And when we went to Georgia, she was doing the same thing there until our bad wreck that disabled her. But that being said, the stuff that Grandma did as a LVN, still trying to block that for you, and it just ain't blocking real good, is it? It's the same thing that a lot of these RNs and stuff do now. So Grandma's old school nursing is a lot more. What if I slide that just a little bit? Is that better for y'all? Let me change that too. I've got this propped up on stuff on my lap. Trying to get it for you. I think that's better. But her old school nursing goes far beyond what it did back then. And her old school mentality and way of doing stuff really does work better. One of her pet peeves that actually aggravate her, and I'll bounce around on these stories. We went in and we was having a problem with my blood pressure dropping. We got into the clinic and every time I go in there I see a different doctor. I have a wall of doctors you wouldn't believe. So I get in there and they're going to do my vitals for their records. And no big deal. And for those that's keeping score, Diet Pepsi nowadays. I've pretty much quit on the Diet Mountain Dew. Just got tired of them. Went in there and they're trying to get my blood pressure and they can't get my blood pressure. They're using these modern machines. And now Grandma knows the fancy words. But basically she's wanting to know where's the pressure scope, the pressure hand pump, blood pressure armband thing, and a stethoscope. Because she's like, why don't you do this old fashioned? You know, where's this and this? And they got names. Oh, we don't have those. She's like, are you kidding me? All you have is that damn computer. Yeah. They never did get my blood pressure because it was that low. They got some fancy name for it. Something shock that I was going into. They got me, put me back in the hospital, needless to say. They had to go into a vein here And that's how they finally got my blood pressure, which was real low. Put them into panic mode. I didn't know they had so many ICUs in a hospital, but I learned. I'm not that familiar with hospitals. I mean, you don't really deliver to too many with truck. I have once or twice, but they didn't go giving me a tour of the hospital. I didn't know they had an ICU just for heart patients. They do. And you get pretty attention there too. The one I was in, they had one nurse that sat between had a window into both two rooms, one on each side of them. And yeah, there's males as well as females. And those two patients are their job. Kind of cool. You get the attention you need, sometimes more than you want. But Grandma wasn't happy about that at all. Now I was telling you about that shot. I was taking that shot and I was all jacked up, depressed, crying, mad. Didn't know why I would start crying. And then I'd just get mad about any and everything, just mad. No reason. This ain't like the Papa Joe that we all know and love. And I didn't understand it. Now, I'd done been in the hospital several times by now. I'd done had this. Had done went through the treatment, the rehab, and all that. And I get dumped out on the street, just me and Grandma. And there's plenty of, she ain't understanding either. And I know there's people that's not interested in this. Sorry, see you. I'm just having a hard time dealing with stuff. And I'm reaching out to the hospital people. I'm reaching out to my doctor. And nobody is communicating with me. Nobody. I finally got an appointment to see my doctor, which had been hard. I'd been trying to see her over several months. And I'd get an appointment, but it wouldn't be for a couple of weeks or whatever. And by the time my appointment rolled around, I'm done back in the hospital. And I did finally get in to see her. And it was pretty much at the peak of all this depression, all the deal with the shots and whatnot. It was right before we figured out it was the shots messing me up. And I'm pretty sure it was. We get in there to see her. And we've always been very friendly. We've had her for years. She's a sweetheart. She's a nurse practitioner. So all but a doctor. Very good at what she does. Great bedside manner. We have a great relationship. Hugs every time we come in and leave. We're that tight. Good people. Love her to pieces. She normally has my best welfare, my best interest forefront. As she should. She's my doctor. First thing she asks me when she walks in, of course, she's smiling. Grandma gives her a hug, and I just sat there. She did bend over and give me a hug. And she says, "How you feeling?" And I said, "Abandoned." Kind of caught her off guard. I said, "And by you too?" "Why me?" I said, "I've been trying to get in here to see you, and I'm starting to fall apart, starting to tear up. Been trying to get in to see you. I can't see you. Can't get in here. I call and leave messages. You're not calling me back." I said, "You're the one that started me on this path. I thought you was going to hold my hand and walk me through this and explain what's going on." I said, "And I can't get in to see you. You don't return phone calls." I said, "I've just been thrown in the street on my own. Me and Grandma are trying to figure this shit out, and we're having issues." And boy, did that strike home with the girl. I call her girl. Hell, she's got kids going off to college. You know, so she ain't no spring chicken. That kind of hit home with her. Now, I don't know, but I know when we went back in a month later, she cleaned house on her staff. Because she had told me, Joe, I ain't been told about you calling, leaving messages. Didn't know you was trying to get in to see me. I didn't know any of this. I said, well, it's all true. And, of course, she didn't doubt me. She got pretty upset, I think, with her crew. And I'm not saying I'm the reason they got fired. I don't know. I know they had been there a long time, and when I came back, they weren't there no more. It was all new people. And I said, you cleaned the house, didn't you? And she said, yeah, pretty much. And she let it go at that, and so did I. So I didn't push that. She got me on some depression medication and something else. She got me on a couple pills that did help me mellow out. The reason I bring that up, now, let me go into the rest of the story. So we kissed and made up. She took care of me. She had not been getting the reports and stuff from the hospital. They're always asking you up there who your PCP is, and I would tell them. And told them I wanted everything to go to her. Everything. And she wasn't getting it, and she wasn't getting my messages. So, yeah, she was beside herself, and by the time I went to see her again in a month, she had did her homework and told me that I had shit going on that she had to look up and study on. It was just beyond what she normally does. Well, cool. You know, because I had literally told her, I said, you started me on this. Why didn't you just let me go ahead and die? Just let me have the damn heart attack and be over with it. Why put me through this and then abandon me? And I think that's the part that really got her the mostest. But no sugar added, folks. You all know me by now. Those that have made it this far into the video, you know me by now. I just don't sugarcoat real well, and I don't want it sugar-coated to me. Tell me the damn truth, I'll deal with it. Good, bad, or indifferent. So then, a week later, I guess, I have my next clinic appointment. So we go into Houston, which is a bit of a drive from here, over an hour. It's downtown Houston. So we got to go from the north side up here north, about an hour north, all the way downtown. Fun stuff. My two sisters next door are my chauffeurs. It's easier in their car than my big truck. Get in to see this doctor. And the pills are working, but they're not working 100% yet. I'm still fighting with issues. So I'm not even going to say it was a whole week later. And I go up on that old boy, on that doctor. I hadn't never seen him before, but he was part of the team. And I explained to him that they just threw me in the streets. They did not educate me on what I was going to be dealing with. Physically, mentally, emotionally, none of it. And I told him, you boys are good at what you've done. You've saved my life. A few times, actually, folks. I said, however, where you're smart on that, you're lacking on the bedside manner and educating people on what they're going to have to deal with out there. You're only seeing this side of it. You need to make yourselves aware that there is another side that we have to deal with, and it needs to be addressed. You need to educate your patient on what they're going to get out on the streets, what they're going to deal with once they're out of this hospital and they don't have all this immense care right here. You know? I was a little upset. He handled it well. He handled it like a professional. Reason I'm telling you these stories, and there's a couple more that I'll add to it. Those are the only two on that part, on bad-mouthing anybody, is because people have to understand that you are in control. I know they come around throwing around their orders, their marching orders, and do this, do that, da-da-da-da-da-dee. Most people don't have it in them to say, wait a damn minute, that don't make no sense. Why would I do that? Or, no, that's not happening. We need to figure out something else. Guess what? I'm not one of them that's afraid to speak up and stand up for myself. And if it's something that I miss, I got Grandma back there. She's got my 200%. So, remember, folks, even as a patient, and this doctor with all that knowledge and all that alphabet soup behind his head, he's still working for you. Don't be scared to say, whoa, hold on a damn minute. That being said, and it goes right along with the old school nurse like Grandma and modern day RNs. This PICC line that I have, it goes to a pump over here with a bag 24/7. Normally, in the line I was trying to think of before I had with antibiotics, that's called a midline. It went in over here in this area, and it only went halfway to my heart. It just got way up in there where it wasn't quite a typical, damn it, I hate it when I lose words. Where it wasn't a typical IV. It goes farther up into your body so you don't pull it out. It don't come out as easy. But this PICC line, it goes in here and runs over my heart. Normal PICC lines, and including that midline, you flush them. When you change out the lines and the bags and all this, you flush them. The doctors do not want this PICC line flushed. They don't want it interrupted. They don't want any other medications put through it. And their whole thing is they don't want that big of a interruption in the flow. They said if we're not careful and do it wrong, I can get a big shot of this medication, which ain't going to do me good. All right, cool. We can deal with that. Several times in the hospital, they wanted to take my PICC line off and use it for a blood draw. No, you ain't doing that. Several times they wanted to take it off to give me some other medication. No, you're not doing that. I would have other IVs, but they would be hard to work with, so they're looking for the easy way. So they go to the PICC line, and I had to make a few of them. One of them got as far as getting it off, and I'm like, what the hell are you doing? It was the middle of the night, woke me up. You know how that goes if you've ever been in a hospital. Nothing waits in the hospital. It's time for meds, they wake you up, take meds. If it's time for this, that, or something else, they come in and do it. If you wake up, cool. If you don't, oh well. I wake up, she's got this PICC line off and getting ready to flush it and do some blood draw. And I'm like, oh, hell no. Put that shit right back together. Leave it the hell alone. So, even in this day and age, you got to watch them. And if I didn't have my act together enough and woke up enough, then who knows, So people, you got to watch out for yourselves. And if you're in bad shape, which there was a few days that I lost in there, I was in that bad of shape. Grandma had to tell me after the fact some of the stuff that I did, said, talked to people. I don't even remember it. I was going to leave the ward and go have a cigarette, and the girls are trying to stop me and threaten me with security and all this, and I'm like, okay, bring them on. I mean, I wanted a cigarette. Grandma came off the elevator about this time, and she reads the room real fast. She grabs me by the elbow and, come on, baby. You can't go down there right now. We need to go back over here. And she gently guides me to my room, got me calmed down, and all was good, So, like I said, Grandma's got my back. Talked to a few people I didn't remember talking to. I lost several days there. I was in pretty rough shape. Reason I bring that up is when you're in those conditions, you need to have a grandma around. Whoever your grandma is, whoever's got your back, you need to have them around so that they can stand up for you. And they can say, no, wait a damn minute, why are you doing that? No, I don't want that to happen. So, and with grandma, I ain't got to worry about it. I know people teased me there for a while because they would ask me what medication I was on for blood pressure, for this or for that. And hell, I don't know. Whatever grandma and the doctor tells me. Well, what if they try to poison me? Okay. I hope they do it right. Get it over quick. I've been one of them, and I told grandma over 30 years ago when we got together that I would trust her until she showed me I couldn't trust her. She's never showed me that. Not one iota. Out there on the road, you hear them truck drivers worried about their wife, overspending money, out cheating on them, and I never had them worries. Didn't cross my mind. And I couldn't live with someone I didn't trust. I mean, that's the bottom line. So I literally trust grandma with my life. When I was in there, I got visits from all kinds of doctors at all hours of day and night. Specialists for this and that and something else. And oh my Lord. And I had them pretty much trained. Even the ones that wasn't trained yet, they got to wait. Because every one of them, I'd say, hold that thought. And I'd call grandma up. And I'd put grandma on the speakerphone. And I'd tell them, this is my wife. She's a retired nurse. She's going to listen to whatever you have to say. And if she's got questions, we'll get to answer them. But I want you to talk with grandma. And most of them would take the phone and talk to grandma. So that way she knew exactly what was going on. There's some of that fancy stuff. I mean, I'm not the dumbest rock in the bag, but there's a lot of that stuff goes over my head. I mean, stuff I can't pronounce, stuff they're talking about, I ain't got a damn clue. Well, grandma does. So after she hears their spill, she breaks it down into hillbilly and simplifies it for me. And helps me to understand what the hell they're talking about. It's the best way to have it, To this day, we do the same thing. The doctors or the clinic or any of them they call my phone, I answer it, I say howdy, and then I say, hold on a minute, here's the wife. Here's the boss, And they talk. It's on speakerphone, I can hear them, I can take part. A lot of times I do. If I have questions, I can ask them. And either grandma or whoever's on the phone, they'll answer them. But grandma's my rock. She really is. So I might agitate her at times, believe it or not. Ain't that one hard to believe? And sometimes I get agitated with her, believe it or not. Ain't that a hard one to believe? It's almost like we've been married forever. The care that I got in there for the most part was exceptional. It really was. There toward the end where I came off the heart ICU, the special ICU ward, and went to the regular ICU ward, night and day difference. Didn't get near the care in that second ward, but I was still taken care of. The home time with this stuff, part of that heart pump I was talking about yesterday, they was telling me how this port that comes out of my stomach, that line comes out of my stomach, that has to be cleaned a couple times a day or more. Wow, really? Grandma already deals with this thing. And every night she has to change it from this blue all the way into my bag. Here's my bag. You see the cords on it. I'll go ahead and unzip it here. Let me see if I can reverse this camera. All right. Now I'll open it up. Lay you down a second. Yeah, it got dark. On this side is my bag of medicine. Goes down through here. It's got this line here, runs into this pump. Let me close that back up. Over here on this side, probably gonna wind up laying you down again. Now we got a line running up here, comes up the top. Here's the one coming into the bottom. Oh, come on. All this Velcro can get you. It can be a pain in the butt. Move over here. All right. Now here's the pump. And that keeps that constant drip going into me. Gotta lay you down again to put this stuff up. I have this attached to me 24/7. And every 24 hours, I'm almost done. Show patience, peoples. Zip it back up. And right now I'm using it as a prop for my camera. There we go. There's that. Switch it back around. Let's see. There we go. So that's the pump that I'm attached to all the time. I have leeway on these new bags of medicine. Last time I was in, they changed my meds. They increased it. They didn't change it. They just changed the dosage and stuff. But every 24 hours, more or less, I have to, we have to change the bag. So Grandma will go over there and she'll set up the new bag on. I have 2 pumps. They get swapped out daily. So she will set up the new bag and pump over there. And I take the bag and the stuff apart in here where I can turn this one off and all that good stuff. So she's already got work to do with this. That heart pump stuff, it would have made it so much harder on her. It really would have. Having to do that pork dressing and stuff even once a day, but I was talking about having to do it 2 or 3 times a day. That'd been a lot. And the whole battery issue and I mean, it just wasn't something I wanted to do. It wasn't practical. Not for me. So that pretty much gets you up to where I'm at now. I'm somewhat stable, but I'm still dropping. Supposed to be. Nature of the beast. Still dropping the weight. Heart's still getting weaker. You know, vitals and everything's okay. But we know that in the long run, stuff's going to start shutting down on me. And we're just waiting. So, I think that pretty much updates you on all that stuff. The next video, maybe I'll make it about something else. Some of my thoughts. I can't think of anything that I forgot to tell you. I'm sure there's something. Speaking of ambulances, there's one now. A Band-Aid box. Now, one thing I was thinking about a while ago, I laid down and tried to sleep. I couldn't go to sleep. And I got to think about some of the stuff to tell y'all on this. One thing that crossed my mind was a lot of these RNs where I was talking about them wanting to do the blood draws and whatnot through this tap pick line. You know, they reminded me a lot of modern day truck drivers, where they're taught just enough to be dangerous. You know, these modern day truck drivers we complain about out there, the new guys, they're actually pretty damn dangerous hitting that road. I was when I hit the road. Any of us are. But, of course, we think today's is worse than we was, and every generation thinks that. It's nothing new. If you're part of the new generation, guess what? When you get part of the old generation, you're going to think same thing about those coming in behind you. I feel a lot of it with the nursing industry was the same way. And they would have people come around every few days and talk to you and see if you got any complaints, any suggestions, any attaboys. And that was one of the things I told them. I said, your nurses need to educate themselves on their patients and on their medications. And I told them about this PICC line and stuff that had happened. And they need to know when they come in whether that is life-threatening or not. That's my lifeline. This medicine is my lifeline right now. Without it, I am very limited. Cuts into that year real drastic. So that's just a little comparison I made in my head laying back there and trying to go to sleep. So this is Drug Out. Don't expect a lot of people to watch the whole thing. If you do, thank you. The comments and whatnot on last night's video, actually it was this morning. Thank you. Comments was appreciated. A lot of love there. Seen several people had viewed it. Seen a lot of them didn't watch all of it. 18 minutes, I think, was the average. Really? And I don't know how long it went on, over 30 minutes, I know. It doesn't matter. I'm not doing this for the views. I'm not doing it for the likes. I'm doing it for my ancestry. I'm doing it for me. A lot of you folks are just along for the ride, or you're not. There'll be people that find this morbid and everything else. Don't watch it. You know, seriously. If you're some of my kinfolk, well, I hope you learned something from it. If you're not my kinfolk and you made it this far, I hope you learned something from it. Learn from my experiences, please. With that, I'm going to let you go. Remember, God loves you. So do I. It ain't nothing but life, folks. We live it. We live what's dealt to us. So enjoy yours. I'm trying to enjoy mine. Bye.